Joining me now is Tarik Jasarevic, spokesperson for the World Health Organization. Tarik, thank you very much for joining us this morning.
Good morning, Roger.
So how will the UN resolution affect aid to Gaza? Is it going to make a difference?
Well, we have been talking, Roger, a few weeks ago, I remember, and I was saying how much we need this access, sustained and unhindered access to bring humanitarian aid, including medical supplies. So indeed, as my predecessor was saying, it is a positive step to have some sort of agreement between member states on some wording and on need to bring in humanitarian assistance. However, what Gazan people need is ceasefire. As long as they have been bombed and pushed around to ever smaller corner of Gaza, there will be more people injured, there will be more suffering, and with whatever supplies we can bring in, that will not solve the problem. The real problem is lack of peace right now.
What are your biggest fears with that situation where they're being pushed into a smaller and smaller area? You have colleagues on the ground there. What are you hearing from them about their concerns?
Well, there are three types of risks first. First one is, as I just said, people who will get injured in bombardment and who will not be able to get a trauma intervention that they would need to get. There is less and less hospitals available to provide any sort of assistance, let alone complicated surgical interventions. Secondly, you have 50,000 pregnant women in Gaza. You have more than 300,000 people with chronic diseases, diabetes, cancer, hypertension, who need their treatment and who may not get it right now. And on top of that, you have a risk of infectious diseases. We are seeing more and more respiratory disease as temperatures are dropping down, as people are pushed into crowded space, more waterborne diseases and more skin infections. So really not having possibility for people of Gaza to resume normal life and health system to be rebuilt, that's really, we will not be able just with some trucks to solve the problem of more than 2 million people in Gaza right now.
Now, Israel is allowing aid through one of its border crossings and also Rafah. How much more is needed, though? Is that not enough, what they're doing?
That's nearly not enough. And again, it's not about number of trucks. It's also providing safe delivery. We have been systematically stopped, checked. There are long delays on the checkpoints. Sometimes health workers have even been detained by Israeli army. So if we can't really, if we just have 15 minutes to spend in a hospital, that's nowhere enough, even if we get supplies in. So it's really creating humanitarian space, having unhindered access. And again, I just want to repeat, we just need bombs to stop raining down on Palestinians.
Now, you say a full ceasefire is the only way. What would it take to have that happen then?
That's clearly a political decision. We as a humanitarians, we are ready. We are ready to bring whatever is necessary, even additional capacity. So experts in different areas, anesthesiologists, surgeons. So because many health workers have been killed, many health workers had to take care of their family. So there is a less of capacity now in terms of expertise. So we are ready to bring those things in. But again, it's difficult to do it without being allowed to do that in a safe way.
Tarik, thank you very much for the update.
Thank you.